If you're studying for the infection control exam, this chapter carries more weight than anything else on this test. Prevention of cross-contamination is the single largest domain of the entire ICE exam, and it all comes down to how you manage surfaces. Today we're breaking down environmental surfaces, pre-cleaning, disinfection levels, and the chemistry behind it all. ADA fam, it's your bestie Leela. Who else? Welcome back to
The DAStudySpot, yeah.
Chapter 20 is Principles and Techniques of Disinfection, which is another dense chapter. Surfaces, chemicals, categories, methods. And this video is your roadmap through it. So let's get started. But before we do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! The CDC divides every surface in your operatory into environmental surfaces and then split those into two categories. The first category is clinical contact surfaces, and those are the ones touched by contaminated hands, instruments, or spatter during treatment. So think light handles, chair switches, the headrest, drawer handles, the bracket table, anything the dental team is constantly touching mid-procedure. The second category is housekeeping surfaces, which have a lower risk of disease transmission. So those are floors, walls, and sinks. They still get clean, but they don't require the same level of disinfectant as your clinical contact surfaces. There's actually a more specific breakdown within clinical contact surfaces too. Touch surfaces are directly touched by a team member, but transfer surfaces aren't directly touched but come into contact with instruments that then touch other things. Both matter and both show up on the exam. There are actually two ways to manage surface contamination, and the exam wants you to know both by name. The first method is surface barriers. These are plastic wraps, bags, tubing, plastic back paper. You place them before treatment and discard them between patients. Your second method is pre-cleaning and disinfection, where you physically clean a surface, then apply a disinfectant to kill the microorganisms left behind. Now, each method has its own advantages and disadvantages. Barriers protect surfaces but add plastic waste and cost, while pre-cleaning and disinfecting requires more time but doesn't damage equipment the way some barrier adhesives can. Knowing when your office would lean toward one over the other is exactly the kind of judgment call the exam likes to test. Now, these two terms get mixed up constantly, and the exam knows this. Precleaning means reducing the number of microorganisms on a surface before you disinfect it. If blood or saliva is visible, it must be pre-cleaned first because that layer of bioburden can literally block the disinfectant from working. Then you have disinfection. This is the process that follows. It's intended to kill disease-causing microorganisms remaining on a surface, but it does not kill everything like bacterial spores. That's an important distinction. Disinfection is not the same as sterilization. Disinfectants are classified by the EPA into three levels, and matching the right level to the right surface is central to this whole chapter. First is high-level disinfectants, and they are sporadical. They're capable of killing spores, and they're primarily used on heat-sensitive items through immersion, not on regular surfaces. Next is intermediate-level disinfectants. These are your hospital disinfectants with tuberculocidal activity, meaning they can kill Mycobacterium tuberculosis. These are your go-to for clinical contact surfaces. Lastly, there's low-level disinfectants, and these destroy vegetative bacteria, some viruses, and fungi, but they do not touch tuberculosis or spores. These are reserved for housekeeping surfaces, so floors, walls, and sinks. So I'm not exactly walking through every chemical category and exact contact time in this video. We still have glutaraldehyde, OPA, chlorine dioxide, iodophors, synthetic phenols. Each of these have their own profile with advantages and disadvantages, and that level of chemical by chemical detail is exactly what's fully broken down in the iSuccess bundle. Some items in your operatory are disposable only, some are reusable, and some can go either way. And the exam expects you to know which one is which. Disposable only items includes things like prophy cups and brushes, sterilization pouches, syringe needles, or sharps containers, and these are items that are never reused because processing them either isn't safe or isn't practical. Then there are items like impression trays, HVE tips, and burrs that can go either way depending on the material and your office's protocol. And your single-use items exist specifically to reduce the chance of patient-to-patient contamination because unlike reusable items, they don't have to survive a cleaning, disinfection, or sterilization process. Here are two more high-yield pieces before we wrap this up. Your high-volume evacuation system needs daily attention. The traps inside it collect debris and must be cleaned regularly, and the lines themselves need routine flushing to keep contamination from building up. This chapter closes with something worth knowing conceptually: greener infection control. Things like digital patient records and digital radiography reduce paper and chemical waste significantly, while reusable sterilization pouches and washable protective gowns cut down on single use plastic. This is a growing area in dentistry and it's touched on in the outline too. All right, besties, that is chapter 20's roadmap. Environmental surfaces, pre-cleaning and disinfection, the 3 disinfectant levels, single-use versus reusable items, and greener infection control. This is prevention of cross-contamination, again, the single biggest domain of your infection control exam. So if you want to go deeper into this chapter, the full chemical by chemical breakdown, contact times, advantages and disadvantages of each disinfectant, and the complete surface classification chart, I cover it all in my iSuccess bundle, which is linked in the description box. Found this video helpful? Be sure to like, save, subscribe to the DA Study Spot, and share with a DA bestie, and I will see you both at the next study session. Bye. The DA Study Spot, yeah.